Hi, I'm really excited to be here to present to you. I actually gave up a few days in Hawaii to be here, so I hope that we can have a really good time. But I'm going to be talking to you about using hypertonic saline solution and furosemide or Lasix IV to diurese patients with heart failure in the hospital setting. So heart failure, of course, is when the heart is not pumping effectively enough to meet the demands of the organs, and usually the fluid then backs up either into the lungs or into the rest of the body, resulting in shortness of breath or peripheral edema, swelling in your feet or ascites or things like that. And it is the most common reason for hospitalization among patients over 65. And as we were just talking about heart failure, you can see it is it's a very prevalent issue and very expensive. So why this topic? Well, I used to work on the cardiothoracic ICU, and there, after heart surgery, we would usually give the patients albumin and Lasix to help them diurese. But then when I moved across the hall to the cardiology floor, I found that we only used Lasix to diurese patients and not albumin, and I thought, well, why is that? So I looked into the research and looked like there wasn't really anything about using albumin, but there was this stuff about hypertonic saline solution, so basically salt water to help you with this diuresis. So I used a PICO question, what is a PICO question? PICO stands for Population, Intervention, Counter-Intervention, and Outcomes, and it helps you to focus your study. So my population were the acute decompensated heart failure patients, intervention, hypertonic saline solution with furosemide. Counter-intervention was furosemide alone, and then the outcome that I was most interested in at the time was increased diuresis. So then I went through the literature, searched through the different things, looked at my primary research, and synthesized it, then looked at my secondary research, which was the integrated things like your meta-analyses or your systematic reviews, things like that. And then you appraise that and synthesize it as well, and then compare it with the recommendations that are currently available, and then derive implications for practice. So I did my search of the literature, looking at EBSCO Premier Sources databases, as well as specifically PubMed. As you can see here by my flow sheet, I started off with 402 articles that I screened. Only 12 of those were actually relevant to my topic. And then I removed the duplicates, so there were only 7 unique articles. And out of those 7, 4 of them were already included in the meta-analysis that I used. So I ended up with only 3 articles. So as you can see, there's not a whole lot of literature out there. We really need more of this stuff. So the first article that I want to look at is entitled Intravenous Salt Supplementation with Low-Dose Furosemide for Treatment of Acute Decompensated Heart Failure. And this is by Okuhara et al. 44 patients were randomly assigned to their control and experimental groups. The experimental group received 40 milligrams of Lasix and 500 milliliters of 1.7% saline. The control group received the same dose of furosemide, but in 500 milliliters of 5% glucose solution. And what they found was that the urinary volume was greater in the salt infusion group. The weight loss was also greater in the salt infusion group. And 24 hours after treatment, the estimated glomerular filtration rate, or eGFR, was greater in the salt infusion group as well. So it appears that this salt helps to improve renal blood flow and renal function. So then let's take a look at another study, which was done in 2000, small volume hypertonic saline solution and high dosage furosemide in the treatment of refractory congestive heart failure. This is by Patera et al. 30 patients, 20 males, 10 females, aged 65 to 85 years, with refractory New York Heart Association Class 4 CHF were used. And there was not actually a designated control group. The patients acted as their own control group, actually, because they were unresponsive to oral Lasix prior to the study. So these participants received actually quite a bit of Lasix, but in 150 milliliters of 1.4% to 4.6% saline solution, which they decided the dose based on the patient's serum sodium for the day, and they combined that with their dose of furosemide, which ranged from 125 to 1,000 milligrams twice a day for 6 to 12 days, which was the duration of their hospitalization. And they found, again, that there was a significant increase in the mean daily diuresis. There was also a significant mean body weight reduction between the two groups. And the range of weight lost was between 5 and 20 kilograms, which is quite a bit. So the results showed improvement in clinical signs and symptoms of congestion in all participants as well, and an improvement in the New York Heart Association functional class. So most of these, actually all of these patients were in class 4 functional, which is very, the worst there is. And 15 patients achieved a class 2A. 13 of them also achieved a class 2B, and then the final 2 patients achieved class 3 prior to discharge. So most patients went from class 4 to class 2 from this treatment, and then they continued to maintain that same functional class for the following 12-month follow-up period. This is amazing, if you ask me. Including in that 12-month follow-up period, none of those patients were re-hospitalized, and there was a 20% mortality rate, but compared with previously published rates of 50%, that's actually pretty good. And 3 of these patients, so 6 total died in that 12-month follow-up period, 3 of which were cardiac causes, 3, and the other 3 were not cardiac causes at all. Could have been car accident, could have been anything. They did not specify. So let's sum up what we've discovered so far is that both of these articles have showed increased diuresis when you use the hypertonic saline solution and the Lasix. There's also increased urine volume, and they both postulate that it increases renal blood flow, which leads to the improved diuresis. And neither study reported any adverse events among the participants. So it appears that this is highly beneficial and very low-risk treatment for these patients. Here's a graph of the mean 24-hour diuresis in those 2 studies. The yellowish-green is when patients did not use the hypertonic saline solution, and then the blue bar is when they were using hypertonic saline solution, and you can see how great the difference is between the 2 groups. Then on to our integrated analysis, the systematic review of Gandhi, Mosley, and Myers, entitled Hypertonic Saline with Furosemide for the Treatment of Acute Congestive Heart Failure, a Systematic Review and Meta-Analysis. They used 10 studies. All studies contained a control group, and pooled data showed significant results. There was decreased mortality, decrease in readmission rates, and decrease in the hospital length of stay, of about 3 days, increase in weight loss, and improved renal function, as opposed to decreased renal function, which is what we usually see with prolonged Lasix use. No adverse events were reported with any of these studies as well. So with our primary evidence and our secondary evidence together, we find that they all support what each other has found, which is that the use of hypertonic saline solution and IV Lasix versus Lasix alone is really quite effective. It improves diuresis and weight loss. It improves your renal function. It decreases hospital readmission rates, decreases hospital length of stay, and decreases all-cause mortality. Now, this is something that seems very counterintuitive to us. It's been ingrained in us that low salt is the way to go. Low salt, you must decrease your salt so that you don't have increased water retention and all these things. But it seems that might not be the end of the story right there. So the question, of course the current guidelines are, what do we do what do we do in hospitals right now? We give increasingly increased doses of Lasix or other diuretics that are very powerful and actually very nephrotoxic. And we also restrict sodium in the diet. So those are our current guidelines, completely opposite from what we're seeing in the research here. So does this make sense? Does this seem like something that could actually happen in the human body? The results suggest that treating a patient with hypertonic saline in addition to furosemide is more effective, and it's probable that with the hypertonic saline, it increases the tonicity of the plasma, which draws the extracellular fluid into the vascular space. Then, the research documents an increased glomerular filtration rate, which causes a greater amount of fluid to be filtered out of the blood, and then the Lasix then works to keep that fluid from being reabsorbed. The limitations of this, there is no gray literature included, so there is, of course, this positive publication bias. If you have negative results, you're probably less likely to be published, so I probably didn't see your work.
Good answer.
And also a majority of these trials were conducted in the same place. The Paterna et al. Study was conducted in Italy, as were several of the studies that were included in the meta-analysis. So let's go over once again what we gained from this. So we need more research to back this up, especially in large multi-center controlled trials. Hypertonic saline solution seems to really give significant benefit with minimal risk when used with IV Lasix. This treatment has a really high potential to increase diuresis and decrease re-hospitalization and death among heart failure patients. And it has showed a durable benefit, an increase in the quality of life, an improved functional class, which extended well beyond the acute intervention, which is huge. Do we have any questions? What I'd like to underline is that this is also very cheap, especially when considering that this is a bag of salt water that nobody can, you can't patent it, you can't sell it, nobody's going to make a big profit off of it. Your pharmacist is going to mix it up for you. So that's very cheap. You probably need a central line or a PICC line, low risk, but also when compared with the hospitalizations that it's preventing, that's also sort of, it pales in comparison. So it's pretty cheap. Yes.
I just wondered, would this be, how many treatments would they have to have? They just would monitor day by day, or it would be done in the hospital?
It's done in the hospital, and I think they continue the treatments until they reach the desired effect. So it depends on the patient, how much fluid you have to lose, how quickly do you respond to the treatment. Mostly it looks like the treatment is given twice a day, so it could be done in an acute care setting. You don't need to be in the ICU. Twice a day is a little much to say go into an outpatient infusion center. But some of these, depending on your severity, it could take you 3 to 6 days. I guess the maximum was 12 days, but also the maximum weight loss in that study was 20 kilograms, so that's quite a bit.
And the Lasix is up to 1,000 milligrams?
With that one study, yes.
And
However,
would that be through a drip, just a drip? They wouldn't
I'm not sure. They didn't specify that it wasn't a drip, so I think it was mixed in with the solution. However, in the Okuhara study, it was only that 40 milligrams, and they still saw very, very positive results.